In this session, we will be discussing about the muscles and movement around the hip joint. All of us know the hip joint is one of the most important joint in the body and is one of the largest and most stable joint of the body. And we already discussed in previous classes that a joint is having two functions, stability function and mobility function. Usually these are two opposite type of function, where the stability always compromises the mobility and mobility always compromises stability. But in this case, we have this joint, hip joint is a joint which is stable and which is mobile also. There are different structures which improve the stability of the joint. And it is a joint which supports entire weight of the body in both positions, that is either in static position and dynamic position. This is a joint which supports the weight of the body. And it's a synovial type of joint with ball and socket type of variety. Ball and socket variety of joint. So, and it is having 3 degrees of freedom. That is, it can move in 3 different planes. The movements available in this joint are flexion, extension, abduction, adduction, medial rotation and lateral rotation. We will go through these movements later. Before we discussing the different movements, we will go through the anatomy of the joint. The joint will be having articular surfaces, a superior articular surface and a inferior articular surface. The articular surface are formed by the head of the femur and acetabulum of pelvis. Head of the femur is the inferior articular surface and acetabulum of the pelvis is the superior articular surface of the hip joint. Proximal articular surface or superior articular surface, it is the acetabulum. It is the concave component of the ball and socket joint. It is located at the lateral aspect of the pelvic bone. Now this acetabulum is formed by union of 3 pelvic bones, that is ilium, ischium and pubis. These 3 unites together and makes the acetabulum. And inside the acetabulum, it is covered by an articular cartilage. And the position is, it is facing obliquely forward, outward and downward. So the proximal articular surface is the acetabulum. It is the concave part of the bone. It is the concave part of the joint. Now the distal articular surface. Distal articular surface is formed by the femoral head. So the proximal articular surface was a concave surface. Here the distal articular surface is a convex component. And the distal head of the femur forms 2/3 of a sphere. And again it is also covered with an articular cartilage. And inferior to the most medial point of the femur, there is a part called fovea, which is not covered by articular cartilage. The hip joint is a type of joint, it's a synovial type of joint with ball and socket type variety. It's having 3 degrees of freedom, that is the flexion and extension. Degree of freedom means in how many planes it can be moved. So it can be moved in 3 directions. The first one is flexion and extension, the second one is abduction and adduction, the third one is medial and lateral rotation. Now we will go through, before going through the different movements, we will go through the simple anatomy of the hip joint. So all the joints, there will be articular surfaces, and hip joint is having again 2 articular surfaces, a proximal articular surface and a distal articular surface. Proximal articular surface is formed by the acetabulum of the pelvic bone, and the distal articular surface is formed by the head of the femur. Proximal articular surface, it is the acetabulum. It is formed by, it is a concave component of the ball and socket joint. It is located on the lateral aspect of the pelvic bone. It is located on the lateral aspect of the pelvic bone, and this acetabulum is formed by the union of 3 bones. That is the ilium, ischium and pubis. These 3 bones forms a union of 3 bones forms the acetabulum. It is a concave type of structure and it is the concave part of the ball and socket joint. Like any other joint surface, this articular surface of the acetabulum is also covered by articular cartilage. Now, the position of articular glenoid, the acetabulum is, it is facing obliquely forward, outward and downward. Now, the distal articular surface. The distal articular surface is formed by the femoral head. So, it is the convex component where we discussed the acetabulum, it is the concave component. Now, the femoral head forms the convex component of the joint. So, once we go through the structure of the femoral head, it forms the 2/3 of a sphere, and like any other joint surface, it is also covered with an articular cartilage. Now, we can see the inferior to the most medial point of the femoral, the head of the femur, there is a point called fovea. And this is the point where the ligament, the intrinsic ligament is attached to the femoral head, which improves the stability of the joint. There are certain factors which the strength and stability depends upon these factors. The first one is the depth of the acetabulum and the narrowing of its mouth by acetabular labrum. The second factor is the tension and strength of the ligament. All of us know that the ligament is one of the main structure which gives strength and stability to a joint. So, second factor which determines the stability and strength of the joint is the tension and strength of the ligament. Now, the third factor which improves the stability or decides the stability is the strength of the surrounding muscles. These are the dynamic stabilizers always. And the strength of the surrounding muscles improves the stability, or it depends. As the strength of the muscles improves, the stability and strength of the joint improves. Now, next is the length and obliquity of the neck of the femur, and the last one is the atmospheric pressure. These are the factors which influence the stability of the hip joint. Now, the angle of inclination. Angle of inclination means the angle formed by the meeting of the axis of the shaft of the femur with the long axis of the femoral neck. So, angle of inclination means it is the meeting point of the long axis of the shaft of the femur and long axis of the femoral neck and head. If a pathological increase in the medial angulation, if the angle is increased, it is known as coxa valga. And if there is a pathological decrease in the medial angulation, the condition is known as coxa vara. In both cases, it compromises the stability of the joint. Joint capsule. This is another important structure which improves the stability of the joint. So, the ligament, the joint is having a strong, dense but loose fibrous capsule, and which permits the joint to move a range of motion. So, we already discussed that the hip joint is a joint which is having stability and mobility both functions. So, the joint capsule is a strong structure, but it is loose. So, it allows the enough movements, and it is attached proximally to the entire periphery of the acetabulum. It is attached to the entire periphery of the acetabulum beyond the acetabular labrum, and it covers the femoral head and neck like a sleeve and attached to the base of the neck. Now, we will go through the different ligaments of the joint. These are the ligaments are the other structures which improves the stability of the joint. So, ligaments can be divided into two types of ligaments. There are two types of ligaments seen in the hip joint. These are extracapsular and intracapsular ligaments. In extracapsular means these are the ligaments seen outside the joint, and intracapsular means these are the ligaments seen inside the joint. Now, extracapsular ligaments include iliofemoral ligament between ilium and femur. It is the strongest ligament of the human body. Next one is ischiofemoral ligament. This is a ligament between ischium and femur. And next is the pubofemoral ligament. It is the ligament which forms between the pubis and femoral bone. Intracapsular ligament means these are the ligaments seen inside the joint capsule or inside the joint. The name of the ligament is the ligamentum teres. It is seen between the acetabulum and fovea of the head of the femur. Now we will go through the anatomical relationship of the joint. Anteriorly, the structures in one section of the joint. The anterior structures seen to the hip joint are tendon of the iliopsoas, which is separated from the joint by a bursa. Then femoral vein can be seen on the anterior side, femoral artery and femoral nerves. These are the structures which is seen anterior to the hip joint. The posterior structures seen to the hip joint are tendon of the obturator external muscle, quadratus femoris, obturator internus and gemellae, piriformis, sciatic nerve and gluteus maximus muscle. These are the structures, anatomical structures, which is seen on the posterior part of the joint. The structures which is seen superiorly are the reflected head of the rectus femoris, which is covered by gluteus minimus, medius and partly by gluteus maximus. The inferior structures, anatomical structures seen are the lateral fibers of the pectineus and obturator externus muscle. Now we will go through the different movements available at the hip joint. The hip motions we already discussed is that in three planes the motion occurs. That is, these are three planes are sagittal plane, frontal plane and transverse plane. The motion occurs in the sagittal plane is flexion and extension motion. In frontal plane it is abduction and adduction, and in transverse plane it is internal and external rotation. And there is another motion called a circumduction motion. This is the motion, this is the combination of all these type of motions. Now we will go through the flexion and extension. We will go through the different movements available at the hip joint. The hip joint is a joint which is having 3 degrees of freedom. That is, in 3 planes it can do the movement. The planes are sagittal plane, frontal plane and transverse plane. Flexion and extension in the sagittal plane, abduction, adduction in the frontal plane, internal and external rotation in the transverse plane, and a combination of motion called circumduction also. Now flexion and extension. The muscles which causes flexion are the iliopsoas group, which consists of 2 muscles, that is iliacus and psoas major muscle. Next is the rectus femoris muscle and sartorius. The muscles which causes extension, that is hip extensors, are gluteus maximus and hamstring muscles. These are the primary muscles. There are some secondary muscles also. Abduction and adduction. The primary adductors are adductor longus, adductor brevis and adductor magnus. The primary abductors are gluteus medius and minimus. Now the internal rotation and external rotation movement. The internal rotators are tensor fascia lata and anterior fibers of the gluteus medius and minimus. External rotators are obturators, gemellae and quadratus femoris. Now we will go through the hip flexors. So we already discussed, that is hip flexors are the first iliopsoas muscle group are the primary hip flexors. It consists of 2 muscles, iliacus and psoas muscle, psoas major, and there are some accessory muscles, that is which support the iliopsoas group. These are rectus femoris, sartorius, pectineus. We will go through the anatomy of these muscles. The first one is the iliacus muscle. It is one of the major hip flexor. Its origin is from the iliac fossa. Then it comes downward. You can see in the picture, it comes downward and attached to the lesser trochanter. Then its action is flexion. We already discussed it. It is the flexor of the hip joint. Along with that, it laterally rotates the thigh at the hip joint. It flexes the trunk and the pelvis in case of if the motion is in the upper side. So flexion and lateral rotation of the thigh at the hip joint, and flexion of the trunk and pelvis over the thigh. These are the action of the iliacus muscle, and nerve supply is from the femoral nerve. Next muscle is the psoas major muscle. So it is the next muscle in the iliopsoas group, and is the one of the prime flexor of the hip joint. And psoas major is a long fusiform muscle located on the side of the thoracic region of the vertebral column and brim of the lesser pelvis. It joins with the iliacus muscle and forms the iliopsoas muscle group. Now its origin you can see in the picture. Its origin is from the transverse process of from the 12th thoracic vertebra to the L5, 5th lumbar vertebra, and the lateral aspect of the disc between them. That is transverse process of the T12 to L5 and the lateral aspect of the intervertebral disc between them. And it comes downward and it is attached to the lesser trochanter of the femur. So we know the action is flexion. Along with that flexion of the hip joint, it is a lateral rotator also. Its nerve supply is from the lumbar plexus, that is anterior branches of the L1 and L1 through to L3 nerve, that is from the lumbar plexus. Next muscle is the rectus femoris. It is the accessory muscle of the hip flexor. It's having an important function at the knee joint. It is the prime knee extensor also. So rectus femoris is the one muscle among the 4 quadriceps muscle group, and it is the only quadriceps muscle which crosses the hip joint. Its origin from the anterior inferior iliac spine, and it comes downward and attached with the other quadriceps muscle and forms a common tendon called the quadriceps tendon, and it is attached to the patella, and later it makes the patellar tendon and attached to the tibial tuberosity. And action is, along with the hip flexion, it's the prime extensor of the knee joint. Nerve supply to the rectus femoris is the femoral nerve. Another important muscle is the sartorius. It is also known as Taylor's muscle. So it is the longest muscle of the human body, and it's a long thin muscle that runs down the entire length of the thigh. You can see in the picture, its origin is inferior to the anterior superior iliac spine. Then from there it comes downward and it is inserted to the anteromedial surface of the upper tibia in the pes and serinus. Action is, it helps in flexion, it helps in abduction, and it helps in lateral rotation of the hip, and it helps in the flexion of the knee joint also. The group of muscles we discussed were the hip flexors. Now the hip extensors. Hip extensor, the prime hip extensor is the gluteus maximus, which is helped by hamstring. So gluteus maximus and hamstrings are the hip extensor group of muscles. And gluteus maximus, it is the largest and most superficial gluteal muscle, and it makes a large portion of the shape and appearance of the buttocks. Now origin of the gluteus maximus muscle. It is one of the largest muscle of the body, and its origin is from the gluteal surface of the ilium, lumbar fascia, sacrum, sacrotuberous ligament. From there, it is attached to the gluteal tuberosity of the femur and iliotibial tract. Action is, the most important action is, it is the prime extensor of the hip joint. Along with that, it externally rotates the hip, and it supports the extended knee through the IT band, and it is a chief anti-gravity muscle, especially in sitting position. And nerve supply to the gluteus maximus is from inferior gluteal nerve. Next extensor muscle of the hip is the hamstrings. Hamstring is having, along with the hip extension, hamstring muscle is having an important function in the knee joint. That is, it is the prime flexor of the knee joint. So hamstring muscle, it is the hip extensor and knee flexor. Along with that, it externally rotates the hip. And it supports the extended knee through the IT band, and it is a chief anti-gravity muscle, especially in sitting position. And nerve supply to the gluteus maximus is from inferior gluteal nerve. Next extensor muscle of the hip is the hamstrings. Hamstring is having, along with the hip extension, hamstring muscle is having an important function in the knee joint. That is, it is the prime flexor of the knee joint. So hamstring muscle, it is the knee hip extensor and knee flexor. That is, it is located on the posterior compartment of the thigh. So along with the hip extension, hamstring muscles is having an important function at the knee joint. That is, these are the prime knee flexors. So hamstring muscles, these consist of three muscles, that is semi-tendinosus, semi-membranosus and biceps femoris. So all these three muscles together known as hamstring muscle groups. Now hip abductors. The muscles which causes hip abduction are gluteus medius, gluteus minimus. These are the prime muscles which causes hip abduction, that is gluteus medius and minimus. And the accessory muscles include tensor fascia lata and sartorius. Gluteus medius is an important muscle in controlling the level of the hip, and weakness in gluteus medius is result in a separate gait called Trendelenburg's gait. Origin of the gluteus medius you can see in the picture, the outer surface of the ilium just below the crest. Now it comes down and it is attached to the greater trochanter of the femur. So main function is, these are the prime hip abductors. Along with the hip abduction, its posterior fibers helps in external rotation of the hip, and its anterior fibers helps in internal rotation of the hip. So along with the hip abduction, these are the rotators of the hip also. That is, posterior fibers external rotation and anterior fibers does the internal rotation of the hip joint. The nerve supply is from the superior gluteal nerve. Next hip abductor is the gluteus minimus muscle. Its origin is from the outer surface of the ilium below the origin of the gluteus medius muscle, and its insertion is at the greater trochanter of the femur. So it is a prime hip abductor. Along with the hip abduction, it does the internal rotation of the hip joint. So it is a hip abductor and an internal rotator of the hip joint. And its nerve supply is from the superior gluteal nerve. The other group of muscle is seen in the hip joint is the hip adductors. So there are three prime muscles or primary muscle hip adductors. These are adductor longus, adductor brevis and adductor magnus. And there are some accessory muscles which helps in hip adduction. These are pectineus and gracilis. We will go through the anatomy of different hip adductors. The first one is adductor longus. It starts from the superior pubic ramus just below the crest. Then it comes downward and it is inserted into the middle 1/3 of the linea aspera of the femur. So action is, everybody know, it is the hip adductor. Along with that hip adduction, this muscle helps in flexion of the hip joint. Nerve supply is by the obturator nerve. Next hip adductor is the adductor brevis. Its origin from the pubic bone. It comes downward and inserted into the upper part of the femur. Action is, along with the hip adduction, it helps in hip flexion also. It is an accessory muscle for hip flexion also. Nerve supply is from obturator nerve. Next muscle is the adductor magnus. This is the largest among the hip adductor muscle group. Its origin is from it's having two heads, an adductor head and a hamstring head. Adductor head is from the inferior ramus of the pubis and ischial ramus, and hamstring head is from the ischial tuberosity. So origin is from two places. It's having two origin. The first is the adductor head and second one is the hamstring head. Adductor head from the inferior ramus of the pubis and ischial ramus, and hamstring head from the ischial tuberosity. And insertion, the adductor head is inserted at the gluteal tuberosity, linea aspera, and the proximal supracondylar line. And the hamstring head, it is inserted into the adductor tubercle of the femur. And action. The action of the adductor head is the adduction itself. That is the adduction of the hip joint, and along with that, this adductor magnus helps in the flexion of the hip joint also. So the adductor head of the adductor magnus is the furnace. It is a flexor of the hip. Along with that, it is a adductor of the hip also. And hamstring, along with the hamstring muscle groups, it helps in extension of the hip joint. Nerve supply, it is having two nerves, two nerve supply, that is a different nerve for adductor head and a different nerve for hamstring head. Adductor head is supplied by the obturator nerve along with the other adductor group, and hamstring head is supplied by the sciatic nerve. Next group of muscle is the medial rotators. Medial rotators are the tensor fascia lata and anterior fibers of the gluteus medius and minimus. Tensor fascia lata muscle. It's a small muscle which attached inferiorly to the long thin strip, that is IT band.